Dr. Andrew Young over at the Center for Hip and Knee Replacement in St. John's, and let's take a few moments trying to answer one of the most common questions for patients who are considering joint replacement. What is the value or what is the importance of losing weight prior to their surgery? So just as background, everybody knows the problem we're dealing with. Being overweight, or in other words, obesity, is rising all over the United States, and there's a large number of people who are not only obese but also arthritic. Those patients are going to require total knee replacement. And the studies show when we look at total knee replacements, we can all see that obesity is a risk factor for the need for revision or repeat surgery. It's a risk factor for infections, and it's a risk factor for complications. And so there is an association between being overweight and problems after surgery. So naturally, the American Association of Hip and Knee Surgeons, or AAHKS, recommends preoperative weight loss before knee replacements, and specifically for patients with a BMI over 40. So because many patients who are obese need total knee replacements, and because obesity has been found to be a risk factor for repeat surgery or infection or complications, the American Association of Hip and Knee Surgeons recommends losing weight prior to surgery, and specifically those over a BMI over 40. But what is BMI? Okay, so how do we calculate BMI or body mass index? So it's a relatively straightforward calculation, but it does require a little bit of math. So it's all done using the metric system, not the system that we typically use with pounds and feet and inches. So it's done the metric system using kilograms over meters squared. And so the official calculation is made by weight in kilograms and then height over meters squared. And so typically you would input your weight into a calculator, a BMI calculator, and your height, and it will give you an index. And that index can range from 20 to 40, and then that will tell you what your BMI is. And it turns out that a 5% change in BMI is approximately 15 pounds. Now, everybody knows that while weight loss may be something desirable, it's difficult and it's complicated. And many patients try to lose weight on their own because intuitively they may have a sense that losing weight will be better for them. And so they will try a number of different methods. Most people just try to cut back on eating. Some people try to starve themselves. Some people go on any number of diets. Some of these are supervised, some are not. But all weight loss will lead to a change in body composition. And so it has to be done in the proper way to maintain muscle mass, because just starving yourself can lead to a loss of lean muscle mass. It can even lead to protein deficiency, or another word for that is malnutrition. And so even though you're losing weight and making yourself lighter prior to surgery, a loss of muscle mass and a loss of important nutrients necessary for wound healing will make your recovery actually harder. And so not only is weight loss complicated, but the actual calculus of does it hurt or does it help isn't so straightforward. In 2022, our colleagues at Duke looked at the issue of preoperative weight loss and weight gain in the setting of total knee replacement. Now, the American Academy of Hip and Knee Surgeons, based on their observations, saw a correlation between being obese and complications. And so naturally, they came up with the recommendation that patients should lose weight prior to surgery. But the clinicians at Duke did some very good science and then actually looked back at the data to see if there actually was a correlation between weight loss and improved outcomes, or to see what would happen. And so let's take a look at their data. And so they asked a very straightforward question, mostly, I imagine, to confirm the hypothesis that weight loss will improve outcomes. And so they specifically asked, will preoperative weight loss or postoperative weight gain affect the outcome of total knee replacements? And I think many of us naturally thought we knew the answer ahead of time. So in this well-designed study in the Journal of Arthroplasty, they looked retrospectively from 2015 to 2019, a 5-year period, and they looked at over 3,000 knee replacements at Duke. and patients were followed for a minimum of 2 years. Surgeons and scientists at Duke collected multiple data points. They looked at BMI, which is again the ratio of weight to height squared at 6 months before surgery, 1 year before surgery. They looked at it on the day of surgery and then postoperatively at 6 months and 1 year. So with all these data points, they could follow a patient's progression before and after surgery. And they used the World Health Organization classification. So normal weight is less than 25 BMI. Overweight is between 25 to 30. And then there's obesity above 30. And there's several classes. There's class 1, which is 30 to 40, and then class 2, or which is considered morbidly obese, over the 40. And they recorded any patients who had a change of greater than 5% BMI, which is, again, typically considered about 15 pounds. And they looked at how those patients did in terms of success or complications after surgery. And what they found was actually surprising to many of us. They found that some patients lost weight before surgery. That was a greater than 5% change in their BMI prior to surgery. But very interestingly, rather than doing better, they found a statistically significant increased risk for revision afterwards. And so this surprised many of us because intuitively we believed that losing weight could only be helpful. But in this study, there was an increase for revision for those patients who lost weight prior to surgery. Secondarily, those patients who lost weight often regain the weight after surgery. The second important finding shows the consequences of a significant change. Now, this meant that weight either went up greater than 5% or went down greater than 5% before surgery. And again, they saw an increased cause of revisions, increased percentage of revisions, a longer average hospital stay, an increased 90-day number of emergency visits, and 90-day readmission. So all of this surprised us, and maybe many of us believed that there was a substantial increase in BMI. There might be increased revisions, hospital stay, ER visits, and readmissions, but this also included those who had lost weight. So it turns out that the issue of losing weight before surgery is not as straightforward as we had initially theorized. So this brings us to a conclusion, and it raises even more questions. And so, again, intuitively, we thought, as most people did, that losing weight before surgery could only be good. But this study out of Duke of over 3,000 patients showed that those patients who had lost a substantial amount of weight before surgery actually had an increased incidence of complications. And who's to say if this is correlation or causation, but it does mean that we have to be a little bit more careful and nuanced with our recommendations. At this time, we still believe overall it is healthy to maintain a normal weight or to lose weight. But these studies show that just losing weight, perhaps in the absence of supervision, this part wasn't studied, but perhaps in the absence of supervision may not be as safe as people believe, and that if a person is interested in losing weight, they may want to do this under supervision so that they can make sure that they don't become protein malnourished or lose too much lean muscle mass. But again, these are just our recommendations based on the realization that the losing weight before surgery is not such a simple question. I think one of the highlights for studies like this show us that it's always important to question our assumptions. Even things that seem obvious are not necessarily so obvious. And it's through this type of science do we uncover the actual relationships and actually potential surprises in a person's success or potential complication after surgery. So at this point, again, losing weight before surgery is a reasonable option. We do recommend that if our patients are committed to this, that they do it under a physician's supervision. But at the same time, because of the findings in this paper, it's not something that we enforce. We don't demand that patients lose weight prior to surgery at this time, because this paper shows that there can be some increased risks because of that. Thank you.